I already know people have knee problems, hip problems, shoulder problems, ankle problems, and I'm sure there's many, many more. So what I want to ask you guys is, has anybody had this pain for a year? Anybody for a year? Anybody 5 years? 10? 20? 20 is enough. So can everybody agree that 20 years of suffering is too much? 1 week to me is too much. If you're suffering for a week, something is wrong, and you have to listen to your body. These conditions are not normal. It doesn't matter what age you are. I mean, this can happen when you're younger, you're older. Arthritis will rob you of your quality of life just because you can't do anything. You can't move. And you're going to be like the Wizard of Oz, the Tin Man, who literally cannot move a joint. Well, here's the good news. We're here to help you today. It's time to do something about it. You do have options. One, you could do nothing about it, and you'll probably continue to suffer. Your condition will worsen. Your medication will just increase. We all know we start out on a certain dose, and then what happens? Our bodies adapt to that, and then they put us on a higher dose, which has more side effects, more horrific problems. Some of us are actually considering surgery because, let's face it, we're desperate. I mean, I want a better life, so if there's nothing else working, I'll do surgery. The problem is surgery today has less than a 50% success rate. Does everybody know that? There's a couple surgeries out there that are very good, but in general, most of them, 50%. So let's just say people in this room, we're talking about knees, shoulders, hips, ankles. It's less than 50% success. I don't care who you talk to. You might find one person that's been blessed that had a successful surgery. And I will tell you, the rehabilitation for some of the surgeries are horrific. My father had 2 knee replacements about 20 years ago. This is before I even knew about stem cells. I would have saved him from it, because what I saw him go through in rehabilitation was horrible, horrible. Now, we doctors, we see patients all the time, so we kind of get accustomed, to pain. It doesn't bother us as much, but to see your own father go through this, I got to tell you, it was pretty tough to watch, and his results were just subliminal. I mean, they just weren't, it wasn't worth it. I only wish that I had this back then to save him from that. So do we have any other options? Absolutely. We definitely have options today.